see a large audience. Let me introduce us, because my name is on there, but Kim is also here. Kim and I are both veterinarians. We work at our practice in Mason.
You want to go up there? Do you want to go up front? Okay. We start over.
We both are specialists. Kim is a surgeon, board certified surgeon. I'm board certified in special medicine. So we have a bit more than the average knowledge on equine medicine. And what we are talking about today is how you take care of your aging horse. An easy thing to start with before we make you all try to follow this up and think later how you have to make notes about it. We're going to record this, or this session, or another session. It's going to be on YouTube in a while. If you were interested in that, you should give me an email in 2 or 3 weeks. I can send you the link, and then you can go through it again and again as much as you want. But we have to be a bit careful because Michigan Veterinary Medical Association just started to warn us about doing things on Zoom and doing things on YouTube, because people see it and then they do what they see on TV or on your thing, and it doesn't work, and then they start suing you. Yeah. So we have to be a bit careful in how we do things. It's going to be 1.5 to 2 hours. We'll see how long it takes to really get through everything. It also depends on how many questions we get. If you have a question and you think it's really important to answer that now and not at the end, because it's just something you see, wave. I might stop and address the question. If it's something you think like, yeah, hey, my grandma has a horse and has that too, maybe tell me at the end of the lecture and not in between. It's going to be a bit interactive. I sometimes will ask you things to give an answer. The reason for that is that it'll keep you thinking. If you sit there in the dark and I'm talking and talking and talking, everybody's going to fall asleep. So to keep you up, sometimes I'll stop it and have a question and then see who's not awake, and I'll guess who's going to get the question. We'll start already with a couple of questions. I have a bunch of pictures here on horses, and I want you to tell me, and I'll see who first maybe ask who's volunteering to do it, and otherwise I'm going to point at you. What you think is how old that horse is on the picture, and that's nice, but it's not really important. What's more important is that you tell me why you think that. And I have not like the date of when the picture is taken on it, so that won't be too easy. You really have to look at the picture and think what you think. Let's start with the first horse. Anybody wants to guess how old this horse is?
24.
22 plus?
22 plus? Where do you base that on?
Well, in my experience, and this is my personal experience, they don't really start getting gray in the face like that until they're pretty far along. And it's in good flesh still. It's maybe a touch sway back, but you know, I would think this one's upwards.
The gray is something that gives it away, but you have to be careful with that because some horses just gray earlier, and some horses have been a lot in the sun. They bleach. It looks different. But yeah, I think I agree with you. The gray gives it away. At least it makes it like it's an older horse. It's not like 2 or 3. Other things that you can see that you say, wow, it makes me think it's an older horse. His back? Yeah. What do you see in the back?
A little muscle wasting over the croup.
Yeah, it's difficult to say that. I still think this horse is quite well muscled. Wait until we get some other pictures, I would say. But if you say this is older, and if he is 18 or 22, I don't know. But in that area is decently to say that. And then he's quite well kept at that age. If he's 22, I quite say, man, I'm happy that there's so much muscle on this when he's 22. But the gray is a good one. That gives you a good, one of the things that you can say, that's why the horse is older. Let's go for this one. If I don't get volunteers, I'm just gonna point at you. So.
Well, and I think he's older too. Yeah. He looks a little sway back.
Yeah.
And then is he a little metabolic with the?
It looks a bit like that, huh? Yeah. And again,
that's not an age indicator, not about that, or not.
Not really. On the other hand, we know that, for instance, Cushing's disease or PPID, we see that much more at age 15 or older. Even like 25% of the horses 15 or older gonna get that. So if you see that, it's not like it's a law that he's older than 15, but it's more likely.
Okay.
And some people just have a young horse that's really fat already and they can look like this. But when you look at this, I agree. I think this is in 18 to 21, 22 horse years old. Still nicely muscled, but you can see it starts all to hang out a bit. It's not like the really young horse. Good. That one. Who's going to tell me something about that one? No volunteers? I see some. Tell me, you're
He looks young to me.
young.
Yeah.
Tell me why.
Well, he's well muscled, his back looks really strong.
Yeah, but you see here, it's a thoroughbred clearly, and it looks like it's in a racing career or a racing condition. For sure, they're not 21 when they're racing condition, and so that helps already to make you an idea that it's slightly younger, 3, 4, 5, something like that. Shows you also that just how fat or how not fat they are doesn't tell you, or how muscled or how non-muscled. The two other older horses we show have nearly more muscle than this horse, but different kind of muscle. They are maybe not running fast, and this one will. And so you see already it's not so easy to say why it's old or not. There are a lot of parameters that you have to take into account to give an idea on age. What do you think about that one? Yeah. Why?
Just a loss of muscle tissue.
It's a bag of bones, huh?
Yeah.
You can see and it's always difficult to judge, is that malnutrition or is that old? But this horse came from where it was really well cared for, and just at an older age it becomes more and more difficult to keep the muscle under. And that's what we're going to talk about, why that is and how you can avoid that. And you can still see muscle groups are there, but yeah, they're not really very well developed, all the piece stick out. That's why I think 35, 40, maybe something like that, old. If you can know that, old, then you're good. This one.
I don't know, just looks out of shape.
Yeah.
That looks like two halves of two different horses.
Yeah.
But
So it's
I
not so
don't know how
easy
that
to
is
say
to
that,
say.
and that's why I mentioned from this one, I don't think this one is malnourished. When you look at this one, that might be one like a rescue horse. And so it looks a lot older than he maybe is. And I don't know where you really base that on, but I think if you look at the back, it's still a quite normal shape. It's not so hollow. You can see ribs, but that could be just not eating enough, or not such a good condition. I think if you think that this is 10, 12, might be right. And part of what you see in, like you see so much more like pieces sticking out of that is maybe more malnutrition than really being old. So you see already it becomes more and more difficult to really see if it's old or not. That's part of the game for today. Let's go for the white horse. Any idea? And if you know him, then you should not tell. How old? Old, young?
He looks beautiful. He could be in his 20s though, just healthy.
Yeah, he's 25 in this picture.
Oh, wow.
And this is my horse, or was my horse. He finally passed away from colic. And he did Grand Prix dressage work until he was 22, 23, and then we went into the police work. And he would do 8 or 9 hours in East Lansing Saturday and Friday and Saturday night, and we could still do all the Grand Prix exercises. That was really nice to surprise people because you could just circle around them when they try to run. Do a cat pirouette or make a very quick turn. So, and we'll talk about it. This horse, he's 18 hands, but in general, even that doesn't get that old. And it's part of the tricks I'm going to tell you today how to keep them like that. But think about that one.
Eight, 10.
Yeah, I would nearly say middle-aged, eh?
Middle-aged, healthy.
Yeah. Not crazy old, eh? Not getting grey, not really having a saggy back. You see quite some muscles on him. You can see the ribs, but that could be a condition from. And again, seeing ribs is not even bad. A lot of horses are in good athletic condition. You can see ribs. Think about the thoroughbred. And so, you see, it's not that easy to just go for the picture and tell you how old the horse is. What do you think about this one? Yeah, looks very healthy, yeah. Very.
Yeah.
I think if you say like 6, 7, 8 years old. 8 is more or less the age that we kind of say that's then they're in optimal shape. After that, things go down. What's going down, I'm going to tell you later. And you base that on, you can see it's very well muscled. He's not fat. You can see all the muscle layers. It's not just like one big blub. You can see that there are muscles, but he's quite well muscled. This horse, if you know him again, don't say. Young, old.
I'd say, yeah, still young.
I'll surprise you. 21.
Good testimony for dressage work.
Grand Prix freestyle championships in Lamplight last year, and he's my dressage horse. He's already presenting, performing at Grand Prix level for 7 years. And again, he can do it all. And he can do it like a robot. Very good and very easy and very well. I think he can do it another 3 or 4 years. Again, and I'm going to tell you the tricks how to keep him like that. This is a bit far away to watch it, but I'll show you a little bit. It's not really scientific, but there are some people that say the years in the horse years are here, and then here is how that translates to what it would be in people years. And I think what's nice to look at is that 12 or 13 years, they say middle aged, that's like 44 years in people. We're going to go in a couple of more slides, go back on what's really going to change when they get older. And we see that those things really start to change at age 12. Then things go downhill. At 8, they're really in the top of their life. And after 12, it goes down. And then it really depends on what you do with him, how fast that goes down. You also can see, like, say for Wally, my dressage, and 21 years, 61, 64 years in people years. A lot of people are very productive at that age, can do a lot. Can even do really good sports if they always have been keeping up with it. And that's one of the things I'll tell you about. That keeping up with this is really important. When we get older horses think they're old and we leave them, I'm not going to work them, because that goes wrong. Then you don't really keep them well. And you can also see, like when my dressage horse, the police horse, 25 years, 74 years in people's years. There's still a lot of people at 74 years old that can do a lot. You have also people at 74 and this is how they move. I don't see them do anything anymore. That's why horses exactly like that. Okay, what happens with horses when they get older? You saw some of the things you've seen already, you know it, because you pick up on it in the pictures and you translate to me why that horse is older. But what happens? When they get older, and I said, like at age 12, that starts to become more evident, a lower metabolism. Everything goes a bit slower in that horse. Everything. So they, the way they pick up things out of what they eat, the way they build that into their muscle, goes all a bit slower. And initially it's a tiny little bit slower, but that goes quicker and quicker. There will be a loss of muscle mass. Over time, even if you keep doing things with them in a proper way, over time still some muscle will get lost and it will not come back. But you have a good keep on that and slowing down that process as much as possible. You also see lower muscle tension quite often. And you see that young horse, part of why you see that is they look so round. And when they get older, even if they have merely the same muscle, it looks a little bit softer. That's because there's not that much muscle tension. Part of getting older. Slower movement. When they're young, man, you're on them and you turn around and you lay in the sand because they've turned around. When they get older, it becomes for a lot of people why they buy an older horse because it doesn't go so fast anymore. Helps. Stiffer joints. We're going to talk quite in detail about stiffer joints and what really gets stiffer in the joint, but that's what everybody says, a stiffer joint when you get older. Your endurance and your stamina gets reduced, so you have a little bit less power to keep up with it. You get tired earlier when you're older. With horses exactly like that. Sometimes their resting heart rate gets a bit higher over time. Maybe when they're 12 or when they're 8, it's maybe like 20 beats per minute, their resting heart rate. And when they're 12, it's 24. And when they're 16, it's 26. And when they're 20, it's 28. So over time, their reserve capacity becomes less. But it goes slowly if you're doing the right thing. What really is important here, we'll talk about it a lot, is reduced elasticity of tendons and ligaments. That's what really gets stiffer. Tendon and ligaments get stiffer. We'll talk in detail why people say the joints get stiffer. It's not really the joint itself. It's more the tissue around it. And that's important because we can something do with that. And then we've talked about gray hair. And then again, the difference. Some horses look like they're really gray at 18 and others look still in the normal hair color when they're 25. So it's not always as fast as in other horses, or there's a difference between horses how they get gray hair, but it happens. Then, that's what if you saw what we all have, how can we slow down that aging? That's only what we can do. We cannot stop it. We can slow it down. And there are a lot of interesting things to do. Very important, optimal feeding. I'll show you that means not like a lot, because then you just make them fat. It means the right feed for the right horse at the right age. I'll tell you more about that. Optimal physical exercise. I will be really on that. Tell you a lot about that, about optimal physical exercises. And that's much more than you all think, quite often. Optimal medical care, really important. If something goes wrong, don't wait too long to try to ask a vet to help you. Because quite often if you do it in an early stage, you can fix a lot. When you wait too long, it becomes more difficult. And so optimal medical care. I'll also tell you what that doesn't mean, like supplements and all kinds of machines and things like that. I'll go into detail about that. Preventive medicine, really important. I'll explain a little bit more about that. And what you don't really realize sometimes, stress reduction. If your reserve capacity gets less, you should not daily be in stress. A bit of stress sometimes is good because it keeps your system going, but chronic stress is wearing you out. It's with people the same thing, it's with horses exactly like that. And I'm going to tell you a little bit more where stress from horses comes from. And people quite often think they do the good thing to their older horse, and they just do that wrong. Okay, let's go for the feed. Oh, let's quickly, hope that you didn't see it yet. For feed. Anybody an idea what would be good feed for horses? What makes you think that it's good for older horses feed? A lot? Very high in energy?
No.
Very high in protein? You mentioned already that the metabolism goes slower, so if you give them a really high level feed, quite often they cannot even process it. And so half of it maybe goes out in the back end. Also quite often it's just too much. What we see here is that maximum 12% of protein in total, especially when you talk about like pelleted feed, grain, things like that, 12% max. And you will see quite often the shop or the industry try to make you believe that 40 to 60% is much better. Because they're older, they need that. That's bullshit. Their muscles don't work that hard. They're for sure not going to build a lot of new muscle anymore, so they don't need that. 12% is really the max. What happens if you give them more? Initially, not so much, more than they pee a lot. But on the long run, it can be an extra stress on the kidney and on the liver. So don't do it. A good combination of amino acids you need from the protein. Protein, the building blocks from protein are amino acids. They're like in the horse 12 or 14 what we call essential amino acids. They cannot make them. They need to get them from their feed. That's why it sometimes goes wrong, because when you have an average feed you give your horse, and you give him a lot of hay, but your hay has very small range of amino acids, and some amino acids are not really in there, then that horse can really have a problem because he's going to miss building blocks for his protein. And so sometimes, especially when you're having a larger amount of hay, it's good to have some lab work done and know what your amino acids in there. And if there's a shortage, then you give that extra. And that's what we quite often see when we see an older horse that really suddenly deteriorates quickly. Everybody says, how is that possible? Nearly always when you go to the feed, you see they miss essential amino acids. And yeah, no wonder they cannot, for sure, not keep up with downgrade in muscle cells because the protein they need is not there. Also important for older horses is non-structural sugar. What is that? It's like the real sugar, like sucrose, glucose, and structural sugars is the things like the plant parts made of, like cellulose. Cellulose really was resorbed in the gut very slowly. Bacteria really need to work on making that possible for the horse to absorb it. And that's what the horse whole guts is made for. When we give them quickly absorbable sugars, you get an enormous peak. When they eat it, 10 minutes later, they have an enormous peak of glucose level, and that is not very good for their insulin metabolism. The older they get, especially when they get more into like PPID, of Cushing's and things like that, that's really a problem. And so keep them on like senior feed. And sometimes it's interesting when you read the label of the senior feed, there's molasses in there or something like that. That's not what you want. It needs to be low in non-structural sugars. And if you read the bag, the label on your bags, it should always mention that. And then you know that you should, and how much sugars? Better not more than 10%. Same thing for hay. If you have hay, and you have a horse that's getting sensitive to too much sugars, let it be determined how much is in there. And if it's too much, what can you do? If there's too much sugar in your hay, what can you do to that?
Let it soak it.
Soak it, yeah. Because non-structural sugars really dissolve quickly in water. That's also why they go so quickly absorbed in the horse. And so if you have hay that has too much sugars, and you let it sit for a couple of hours in water, then all those sugars are in the water. So if you then give the hay to the horse, it doesn't get the sugars. Then you should not give that nice sugar water to your horse again, because then it's not that helpful. I've seen people do that. And so that's not helpful. You make it not wet to make it wet, you make it wet to get the sugars out of it.
Oh, here's a question. About how long should you soak it?
A couple of hours.
A couple hours?
An hour is minimum, but a couple of hours work. Also depending on temperature.
Okay.
If it's in the middle of summer, it will be even rotting after a couple of hours. If you do it now, you have frozen. So it's somewhere in the middle.
Okay.
Yeah.
I just wondered, does it lose other essential things in the hay other than sugar?
No, in general, not too much, because a lot of things don't dissolve so quickly. If you let it sit for 10 days in water, then the whole bale is gone. But no, you're not going to lose a lot quality on your hay by making it soak for a couple of hours. No.
I'm gonna add something quickly on that, is steamers, you've probably seen those things that you can steam the hay, that is not the same as soaking it to get out the sugar. The steamer is for the horse that has heaves and you need to reduce the dust and things like that, it might pull out a little, but it's not the same. So we really have to soak it in order to get the sugar.
Yeah, you need to give the sugars time to dissolve and stay in the water. And if you make your temperature high of a steamer, you do that, but not like much quicker. What's important, several meals during the day, especially when they get older and they have more time, they need more time to dissolve, to absorb what's in the food, in their feed. It's nice to give them little smaller amounts during the day. This is true for every horse, but especially for the older horse. And so, for instance, now when my horses don't get out a lot because it's so bad weather, they get a lot of hay, not a lot of hay, but I'm not going to give them flakes like that five times a day, because then they're all getting fat. So they get a tiny bit of hay, and a half hour later, another half a flake, and maybe another 2 hours later, another half a flake. That is what I mean by spreading the amount of food over the day. It's better for the stomach too. And some people think that he needs always hay in front of him, and then you have a horse that looks like this, not healthy. And not the plan. That was not what we were talking about when you say they need to have some food in front of them, a little bit. When you look at horses in nature, they walk all day, long walks for eating a little bit of grass or something on the some forage that is not even very rich in energy. So that's how they're made. What we make them is sit, do nothing, and give them like an enormous amount of food to eat. Not helpful. Good dental care. I'm not going to go into dental care, but you all have to do and things like that. There are other options for that, but that's important. When they get older, quite often they get more problems with using their teeth in the proper way, and they need that to get all that food back in there. So that's a good one. Look at that. And what I mentioned, laboratory work.
Could you maybe, if you would please, and you cannot expound on the dental, because
No,
okay.
it will be a whole lecture by itself.
okay.
So you will see what I'm going to tell you is much more important than a dental. A dental, a lot of people can do that. All the other things they cannot tell you, so that's why we have to talk more about it. And what's important is your laboratory work on hay. So if you have a large amount of hay, if you have a boarding facility and you have 5,000 bales of hay, have it checked. If you have 10 bales of hay, don't have it checked, because then it could be next party of hay could be different. That's not very helpful. Supplements. A lot of people think that when your horse is going to miss something, he needs supplements to stay healthy. Well, for most supplements, there is no scientific base that it's doing anything, other than keeping the company in business that's making it. There are a couple of things that are important. Vitamin E, especially for the older horse, is really important. Vitamin E is really an antioxidant that is in normal good grass. In hay, it starts to quickly diminish. Quite often, older horses are maybe not out all day in good grass because you don't want that sometimes because of the sugar content. So it's easier for them to get a little bit lower in vitamin E. We have seen in several barns in this region that a lot of horses were low in vitamin E. So for whatever reason, in this part of Michigan, there is a problem with vitamin E in hay to be good absorbed. So when the older horse already has a problem in absorbing vitamin E, that are the horses that really get a problem. And that reflects in a lot of things. Their immune system goes down, especially their muscle system has a problem if there's no vitamin E or not enough. So that's important. Also important, remember the name Elevate, because that's the only vitamin E preparation that really works. There are a lot of vitamin E preparations that you can buy in the food store and things like that, and then they're artificial vitamin E. They're very stable. They stay in the box for years at the same level. It's really good. But they stay in the same level on the horse too. They're not really an antioxidant. Elevate has been shown in some research is the only one that really gives, when you give that to horses quickly, give them a good amount of vitamin E in the blood. All the others don't. Problem is you need that through the vet because you can also easily give them too much and that's a problem. While all the other things you can buy in the food store or even online, don't buy it. It's not good. Magnesium is important. Good thing for magnesium is knowing that it's not so easy to give them too much. So in our horses, for instance, as soon as they get older and they work more than normal, and I'll tell you, our horses work more than normal, that keeps them fit, then they get some extra magnesium. And just magnesium oxide, that's the white powder, and then quite often have a little thing with it, a little scoop, 1 scoop a day. 5 scoops a day, what's going to happen? They get diarrhea. So you will quickly know when you give too much. They don't really die from that, but your whole stall is covered in other stuff.
Where can you get that?
Online, in your food store, whatever.
Okay,
Very, very easy to get.
okay.
It's very easy. And again, don't go for like a little pellet that's specially made for your horse. It's really expensive. The powder is really, it's like a couple of dollars per pound. And the pellets is like a couple of $100 per pound. Flaxseed oil is a really good source of fully unsaturated fatty acids for horses. Helps in inflammation reduction. It's a part of an antioxidant way of keeping your horses healthy. And that's quite often you can get it again in the feed store or online. That's if you want to give an older horse something useful. Not like a whole bucket a day, like a little cup a day or even a little less. Perfect, gets their skin nice and shiny anyway. But there are a lot of substances in there that by itself are a little bit anti-inflammatory without all the side effects of really anti-inflammatories. Adequan and Legend, we'll go back to that in a little bit later, but there's no proof that really works. And especially not for the older horse, making them suddenly more supple. And I'll tell you what you do to make your horse more supple, but not giving them all the fancy, expensive stuff. And it's good to realize there's an entire industry trying to tell you that you have to be a good horse owner and buy all that stuff to be good for your horse. In general, it's not doing anything and sometimes can even be bad. We've seen some horses that got intoxicated from 16 different supplements because nobody has been thought that you maybe not should give them all together. I've been in barns and you see first the feed cart comes and it looks like a train. There are 3 carts more and then the carts with the supplements for everybody that wants to have their horse have that. There's no proof that it does anything, and there is proof it's quite often even bad. Medical care. Do not wait too long when something is happening, especially in the older horse, because it can certainly quicker go downhill. Colic can be more pronounced bad for an older horse, but then being lame from arthritis, when there is already arthritis there, and the horse has never a problem with it, and he makes a misstep and he becomes more lame from it. If you're on top of it and you deal with it, they're quite often good in a week. You wait until 3-4 weeks later or 2 months later, they're still lame. There's a lot of damage done to that joint that you cannot really reverse anymore. So in the older horse, when you have a problem, and not maybe the first day directly call and panic the vet, but if it's there and it doesn't really go away, don't wait too long. Arthritis is common in a lot of older horses. Arthritis is more or less like a nice name for wear and tear on the joint. That's normal. A lot of horses do have that. It's very often not a problem. And when I go on in my lecture, I'll explain you why it becomes a problem. That's not the joint itself. it are the structures around it, the tendon, the ligaments, and the muscles. They go down in condition and they can keep up with the problem in the joint. The problem in the joint quite often is not, unless you go to the Olympics, it's not really a major problem. What really important is DGD, that's degenerative joint disease or arthritis. But everybody will tell you, and as soon as your horse is older, your vet will say, oh, he will have arthritis. Quite often they tell you already without making an x-ray, and the horse is lame, oh, that's arthritis. Could be, but not likely. It's quite often the combination arthritis and not a good tendon and not a good ligament and not good muscle function. That's more important. What really is important if you talk about arthritis is imaging. You need to know what's going on. It's funny that veterinarians quite often say, oh, it's an older horse, you're not going to make x-rays because we see all arthritis. No, you need to know how much arthritis is there. And if you have two front legs that are similar, one leg is really lame, the other is not, and you make x-rays and both joints have a bit of arthritis, it's not likely the arthritis is a problem. When you have a joint and a horse that's a bit older, and they make a picture of just the lame leg, and they say, oh, there's arthritis, and because it's older, then they found the problem, they can inject all kinds of things. Well, if you had looked at the other leg, it was similar. And so, if you start to talk about arthritis, have proof of that, have good x-rays. Good x-rays also means, quite often not in the barn, oh, let's make an x-ray, because they're not good. You cannot see half of it what you would see. Also, quite often the vet that's doing that in the farm, in half dark, looks at the little screen and says, oh, I see arthritis. You cannot even see that under those conditions. You cannot make the definition if that's really bad or not. Go to a specialist. Laboratory work, really good blood work, look at vitamin E. When you think there's a problem maybe with Cushing's or something like that, look at the insulin and glucose level, ACTH, and there are a lot of laboratories, especially in Cornell, that can run that and can tell you if your horse has problems in that case. Is a risk factor or really has it? And then you have medication for that. If they really have Cushing's, Percent is a great drug. And like I told you already, 25% of the horses older than 15 will finally get it, or maybe already have it. But knowing that with blood work is more important maybe than just nilly-nilly starting giving them medication. And that's what we talk here, evidence-based medicine. That means we do something for the horse that's based on some research, not because we think it's good, so let's do it. And that's a difference, again, a difference quite often between the average vet and specialists. Specialists, by being board certified, you have to, more or less mandatory, to do what they call evidence-based medicine. You have to have a reason why you put that medication on that horse. Meaning, I need to have some x-rays and some blood work and can tell you it's really there. While your local vet can say, wow, I think it is, and then give it to you. That's not evidence-based medicine. Or even worse, they give you something that has never been proven in any research to work. And then, especially for the older horse, giving a medication that's not working or maybe even wrong for them, that goes faster. And so it's not, you think you help him, you make the problem worse. I'll come back into that later a little bit more. Evidence-based medicine is not available for those things that everybody tells you is so good. Pulsed electromagnetic frequency. You have seen those things. I have one here, a picture of it. Those little snakes on the horse, and they should have magnetic waves, and you put them on, and it feels great after that. Bullshit. Just no other word for it. Not any proof. But people swear by it. The company that sells them does a great job because you don't have to wait a vet to do this because it's nothing. So they sell that to people, and then if you get one, and after that you sell it to somebody else, a similar thing, you get 10% off the price you had. And then they give you the title of Magna Wave therapist or something like that. So they're nothing, they just bought that, and then suddenly are Magna Wave therapist and drive around and put snakes on the horse. Crap. Layman's laser. That's funny what I mean with that, but laser, this is laser, this thing. The amount of energy is really low. I cannot make here this start to burn until I hold it for 16 days, it's not going to burn. When you have real laser, the amount of energy is that it maybe can burn. We have classes for that. Like really low is not really a lot of energy. This is like a class 1 or something like that. The thing you play with your cat, class 1. When you have one that's really start to do something, there's a lot of energy in there, it's a class 3B or higher. By law, you only can be a doctor or veterinarian to have that. So the most things you see is a laser wrap. Hey, you have a horse with all kinds of red dots on his body. That's just a lot of cat lights. but that's it. There's no, it's not doing anything. The amount of energy is so low that it doesn't even get the horse warm. So again, crap. Vibrating plates, shaker plates, things like that. They were used in human medicine in the idea that you get better from that. What they figure out is what it does by shaking you is that your C-end nerves that make the little sensation where your legs are and things like that, they dull. So if you had pain, you didn't feel it anymore. For sure you feel better. That's a good thing to do to a horse. So he doesn't feel it anymore, and then you can use him more because you think he's good. You're going to wreck him even more. And so those shaker plates, you put them on and then the whole horse is doing this. If you want to do that, take him in a trailer and go on the Michigan roads. You have your own shaker plate. It's a lot cheaper. Light therapy for joints and tendons. That's even more fun. There's no energy in that. It's warm. That's it. And so when you see those things, like you have a little light that you can, oh, the horse feels it. It's just a little bit warm. If you make a sponge and you put some warm water and you put it on the so oh, it feels good. A lot cheaper. Things like kind of booth with some red light in there, or white light or green light. It's just a gadget. There's not any proof that that works. If that would so, and you would go to your orthopedic surgeon, and instead of doing surgery, they would give you some lights on your joint because it's great. Nobody thinks that this is not working. Again, if you look at what the industry wants you make you believe, you're a bad parent for your horse if you don't buy all this crap. Don't fall for it. All kind of advertised equipment that doesn't work anymore in the human field, or is not working anymore because it doesn't do anything. A good one is Shockwave. Even some vets tool use that a lot. What it's doing is it's really giving like little shocks to like power wave, and your tissue should get better. And there's some proof that that sometimes might work. In human medicine, it's already completely left out because other than for a heel spur, not any insurance company is going to pay for it because it doesn't work. So doctors are not interested anymore because you don't have a machine that doesn't pay. So what they do? They sell it to idiot vets that have no idea, and they buy that and they do that. Now you can even buy this, and it's for the horse owner. So you buy your own shockwave. So you have no diagnosis, you have no idea what you're doing, and now you're going to shockwave the hell out of that horse. What might do maybe the same thing as the vibrating plate, so you make nerve endings dull. And there is some research from the Netherlands where they used a couple of horses and they used shockwave, and they were normal in the tendons before, and afterward they looked and they were damaged of the tendons because of shockwave, especially if you don't know what you're doing. So forget that. All that stuff doesn't work. What is important when you think about something what I mentioned, medical imaging, X-rays. If you have a problem, at least know if there's a little bit of arthritis or really a lot of arthritis, and where that is, which joint, and if it's in both legs and the horse is only lame on one, maybe it's something different. And a lot of horses do have, like often when they say a spur. Spur is just a way for the joint, and normally that joint could make 120-degree movement, but there is a little bit of damage to that joint. What nature doing is it makes the edges a bit bigger, so now the joint fits a bit better nearly. That's called a spur. So the joint is still very functional. But when your vet sees a spur, oh, arthritis, bad. Quite often not any problem. It might be a problem when the tissue next to that joint, we'll talk about it again, and your tendons, your ligaments, and your muscles don't work. Then it's a problem. The spur itself is not a problem. And that means that when you're going to do imaging, X-rays are good, but often an ultrasound for looking at the conditions for tendons and ligaments is nearly more important than anything else. A lot of horses over time get some scar tissue in a tendon. They damage a tendon, but it heals. But there is maybe a little bit of scar tissue in the tendon. Is scar tissue elastic?
No.
No. And that whole tendon, what's it going to do over time? Becomes less elastic. So over time, that whole process becomes less elastic. Meaning, if it's less elastic, you should maybe not jump 2 feet 50 anymore or something like that. So knowing that with ultrasound, like wow, this tendon is just not a little bit bigger, it really has a lot of scar tissue in it, can make you help decisions on what is a good career for that horse and what's not. That's much better than saying, oh, he has arthritis based on a spur on your X-ray, and then do nothing with that horse anymore. A horse with some scar tissue can still work, but you might need some adaptation to your work. I'll talk about it later. Joint injections, that's such a good one. Older horse has arthritis, so what we do, we give him something in the joint that's going to help his joint. There's a lot of things that you can use. One of the things that they sometimes do is hyaluronic acid. It's like, more or less looks like the original joint fluid in the joint. And then the vet sticks a needle in the joint, very thin watery fluid comes out. He says, oh, that's really bad, we need to give hyaluronic acid. Hyaluronic acid has shown on research to do nothing. Even if you put it in there, in 4 weeks it's gone. If the joint has some damage, it's gone in 2 days, because it's going to much quicker being used. So don't put your money in that, it's not working. Corticosteroids do a really good job in making inflammation in the joint less. So if there's really a problem, and you want to for short term make that joint happy again, so you can do some rehab, corticosteroid in the joint be good. Willy-nilly corticosteroid in the joint, because you're thinking he's better, like maintenance of the hocks and stifles, is just the stupidest things to do. This was just recent, the last AAP conference was a review paper, so they go over hundreds of papers on the last couple of years on joint injections, and they show one joint injection might be okay. As soon as you're going to do more, you're damaging the joint. Any corticosteroid is going to do that. And they more or less say never do more than once or twice. If you do that, you're more or less guaranteed that you're going to ruin that joint. And that's not just based on 1 or 2 little research studies, that's based on 120 studies over the last 10 years. And so don't do that. Newer things might be better for your joint. Biologics. There are all kinds of things that they take some blood from the horse, do something to it, and then put it back in tissue, sometimes in the joint, sometimes in the tendon. The good thing is it's far less dangerous and damaging than corticosteroids. The bad thing is, for a lot of things, we don't even know what it's doing. It might work, it might not. And some horses do have, are helped with it, other horses doesn't do anything. But at least it's better than corticosteroids. Newer things are on the market where you put a sort of kind of gel in the joint. So if there's a lot of cartilage damage, then you put gel in the joint that more or less makes a nice smooth layer, and it should lubricate the joint. And the initial research shows it does that. The problem is nobody's knowing what it's going to do in 3 or 4 or 5 years. And so we're going to wait for that, and then might be much more problems than we're expecting now. Also, if you don't put it in the joint, tiny little bit next to the joint, you get a huge inflammation. Most local veterinarians that come to your farm and want to put this stuff in, quite often are not even in the joint, or not completely in the joint. And so recently we've seen quite a couple of badly injured horses because that's a major inflammation just next to your joint. And so I would be very careful in doing that. And again, in a little bit I'm going to tell you how you can do without all this in a much better way. What you need for all this is what is here, a good diagnosis first. If you're not sure if the joint is really inflamed severely, has a severe arthritis, don't start putting all kinds of things in there. And so I never get it when people said, well, we're going to just, as a maintenance, inject hocks and stifles. They didn't even make x-rays of the joint hocks and stifles. And an x-ray is not always telling you too much. If I have a joint and I see there's some arthritis, but I'm not sure if that's old and normal or that horse just has a problem, I do an ultrasound and I look at the thickness of the capsule, I look at the condition of the synovial membrane, which tells you much more than any x-ray if that problem is at that moment active or not. And then I can treat. But then you talk about a specialist and not a local vet that can barely handle his ultrasound machine. Now we come to where we can help a lot. Joint health. When you think about it, joint health, oh, that was not the plan. There we go. It's really the balance between supporting muscle groups. If we think about a joint, and I need to quickly find the picture that's here. This is like what the joint we know from ourselves. Think about your elbow. It's a simple joint. You have that sitting here. How that joint moves is the biceps here and the triceps here. When this muscle contracts, your arm does this. When this muscle contracts, it goes back open. And for the horse, it's like that. And it doesn't matter if it's a joint lower down, a joint higher up, or it's even in the back. It's always the same. You have a joint, and on both sides of the joint, or on one side of the joint and the other side's a tendon, but there is always something there making that joint move. The joint doesn't move by itself. And those are the important factors, because what you have here, what you want to do to move that joint in a good way is smooth. If this muscle is far too strong, does this, that's not so good for your joint. You might overflex it at that time. And then if this muscle is doing it too fast, I might overstretch it. What you want to have is that those two muscles work in a good combination together, so wherever this is, move, stop, stabilize the joint. I can stabilize the joint with this, with 3 grams of force here and 3 grams of force here. I can also stabilize it with 100 grams and 100 grams. What do you think that happens if I use 100 grams and 100 grams? What do you think of the pressure in that joint? It goes up a lot. And that's where we can help our horses. When we make that muscle, that balance better, and we work with a muscle tension as low as possible, we're going to help to keep that joint in a good shape. And that's where it goes wrong. A lot of what we do with our horses, how we ride them, how we do, it's not like that. We make them use muscles far too long, too strong. That's where it goes wrong. And what you could do, for instance, and I know some of the people here, I've seen it in an earlier lecture at Centennial when we were talking about myofascial release. When you have a muscle that is really tight, and it cannot even relax anymore completely, and you can do myofascial release, that's a technique that you tell that muscle from, hey, listen, I give you a signal here, you can release, then you help. That's much better than giving the horse, for instance, a muscle relaxant, so that he has no control anymore. Or you think, wow, the joint is painful. Yeah, the joint is painful because those muscles cannot really move the joint in the normal space. Then you give an anti-inflammatory for the joint. Do you think that's going to make a difference for those muscles? Not at all. It's how we ride and how we do exercises with our horse. That's what makes our muscles do a good job. And this is one of the most important things that we're going to talk about in a bit more again. The full range of motion, and my joints can do this. 60, 70 degrees for normal motion. Other joints might do only 2 or 3 degrees, but you have a full range of motion. If I always keep it in that full range of motion, at least three times a week, move with that joint through the full range of motion, I maintain that. Now I say to this joint, well, this is good enough. What's going to happen with that joint? It's going to make that its normal range of motion, and after it's stiffer. So when we talk about a stiff joint, it's a joint that cannot move anymore through its normal amount of motion, but it's because the muscles on both sides don't do a good job. Everybody ready for a little break? Because I see a lot of people nearly falling asleep. I have not enough red lights to beam everybody up or throw things. I think we'll have a 10-minute break, and then we'll go on.